Autoimmune diseases affect millions of Americans, and many people may not even realize they are lingering symptoms, and they could be early signs of some of those things. Kelly is here with us this morning to help us better understand how to recognize the symptoms and what steps people can take to protect their long-term health. So thank you so much for joining us today. Why don't you go ahead and tell us, maybe for the viewers that don't necessarily know what an autoimmune disease is, what it is, and maybe some that are more common and some that aren't as common.
Sure. So autoimmune disease is a subcategory of chronic diseases whereby a person's immune system is mistakenly attacking their own body. So essentially the immune system is in overdrive. Some common ones that most people may have heard of would be like MS, rheumatoid arthritis, celiac disease, Hashimoto's hypothyroid, and then there are actually over 80 of them. So some less common ones may be Sjogren's syndrome or SLE. But in all of these instances, that same thing is going on. The underlying problem is the immune system mistakenly attacking the person's own body.
Okay, so when it comes to things that we can look at within ourselves, we're the people that know ourselves the best, right? What are some early signs that we should be looking for some of those autoimmune diseases?
So symptoms range from very general, kind of in all these cases, probably people are going to feel fatigue. Things are going to feel off. You know, our bodies are our own best messengers. Symptoms are telling us a message. And then for some of the instances, there might be very specific symptoms. But I would say, broadly speaking, you want to be looking out for fatigue. You want to be looking out for, say, digestive problems, skin issues, kind of systemic. Your body's not working right. And so always listen to that if your body's telling you something.
Are some of them preventable, where if we catch kind of things early, we're able to prevent them? And then on the flip side, are some of them, once we get an autoimmune disease, curable?
Sure. So in terms of pathology for autoimmune disease, first of all, you have to have a genetic predisposition. So having that predisposition is not avoidable, not preventable.
Okay.
But it doesn't mean if you have the gene that you will actually get the condition. There has to be a trigger. And so there's two broad camps of triggers. One would be, sort of lifestyle events. Are you eating how is your diet? How much are you sleeping? Have you been through a high period of stress or trauma? Those are lifestyle factors. And then on the other hand, there could be an immune system challenge that you've gone through. Maybe it's a viral infection. Often autoimmune disease can trigger after a viral infection. And then in terms of, is it preventable? You know, what you really want to do if you have a genetic predisposition is make your immune system as resilient as you can. You know you are at risk if you have gotten a genetic screen for it. But anyone should be taking care of their immune system. This is why chronic disease is a problem in our country. Not enough people are taking care of proper diet, exercising, making sure we sleep enough, making sure we manage stress enough.
All of those things,
anyone
right?
should be doing those things regardless if you have a genetic predisposition.
Exactly, for mental health as well, too, right? Kelly, why don't you tell us about your work with End Chronic Disease?
Sure. So End Chronic Disease, my organization, is a national nonprofit focused on hopefully ending chronic disease in America. And we do this through public awareness and policy reform. So chronic disease is the #1 cause of death in our country. 76% of adults have at least one chronic disease, and these are largely preventable, as much as 80% preventable. So we're here trying to incentivize people and systems to take more preventive approaches.
Well, thank you so much for joining us today. Of course, actually, Kelly has her own personal story with chronic disease. If we want to follow you on social media, if we want to keep up with you, is there a website we can go to, an Instagram that we can follow along with you and End Chronic Disease as well?
Yep, our website, endchronicdisease.org. There you see our End.chronicdisease Instagram handle.
All right. Well, thank you so much for joining us and giving us a little bit deeper of a look into the autoimmune disease environment. Thank you so much.
Thank you for having me.